Good afternoon everyone, I am Mrs. Deepika Sri. Today I am going to explain about the series of cholecystectomy. Already we saw videos of the gallbladder carcinoma. Now we are going to see the surgical treatment of gallbladder carcinoma. The surgical treatment mainly is the cholecystectomy. Cholecystectomy is also called a simple cholecystectomy. This procedure involves the removal of gallbladder, and extended cholecystectomy is the removal of gallbladder 1 inch or more of liver tissue located next to the gallbladder and all of the lymph nodes in origin. So this is the procedure of the gallbladder. There is the cystic duct, liver, gallbladder, common pilot, duodenum cut here. In this part, the obstruction of the cystic duct of gallstones, inflammation of the gallbladder is there. This is the common bladder. So the surgeon made the incision on here. So now the cholecystectomy is a surgery to remove the gallbladder. The gallbladder is small organ under your liver. It is the upper right side of your belly. The gallbladder stores a digestive juice called bile that is made in a liver. There are two types of surgery is made. One is open, another one is a laparoscopic method. The open is the traditional method, that means the older one. So the open method, in this method one incision about one incision about 4 to 6 inches long is made in the upper right hand side of your belly. The surgeon finds the gallbladder and take it out throughout the incisions. Another one is laparoscopic method. In this method uses 3 to 4 very small incision. It uses a long thin tube called a laparoscope. The tube has a tiny video camera and surgical tools. The tube camera and tools are put into throughout the incisions. The surgery does the surgery while looking at the monitor. The gallbladder is removed throughout one of the incision. A laparoscopic cholecystectomy is less invasive. That means it uses very small incision in your belly. There is less bleeding and the recovery time is usually shortened than it is for open surgery. In some cases, the laparoscopic may show that your gallbladder is very diseased, or it may show other problems. Then the surgeon may have to use an open surgery method to remove your gallbladder. So, a cholecystectomy may be done if your gallbladder has a lump of solid material called gallstones. It's red or swollen, inflamed or infected, is cancerous. The gallstone may cause pain. It is usually right side or middle of the abdomen, may be constant or may get worsened after a heavy meal. Many may sometimes feel like fullness, then pain may be felt in your back and in the tip of your right shoulder blade. Other symptoms may include nausea, vomiting, fever, chills. The symptoms of gallbladder problems may look like other health problems. Always it should take the consent to treat. So the risk of cholecystectomy is bleeding, infection, injury to the tube, that means the bile duct that carries bile from gallbladder to the small intestine, liver injury, scars and a numb feeling at the incision site, a bulging of organ or tissue at the incision site. During a laparoscopic procedure, surgical tools are put into the abdomen. They may hurt your intestine or blood vessels. And these are the points about cholecystectomy. So cholecystectomy, now we are discussing about what is cholecystectomy, what are the types of cholecystectomy. That one is laparoscopic, another one is open, and the symptoms after the cholecystectomy, and also the risk factors and complications the patient going to handle after the cholecystectomy. So these are the points we made a discussion about the cholecystectomy. It is one of the surgical procedure and it is suggested for cancerous patients. Thank you.